It is very brave and powerful to be able to take control of your mental health. To be able to call and reach out for help is so powerful, and being able to use this powerful medicine in such a safe way, there's no need to fear it, because imagine like me doing anesthesia, I give such high doses. And in this infusion, it's very low dosing. So it's very, very safe, very therapeutic.
Welcome, Tribe. I'm Mayah Rose.
And I'm Gerald Rogers. We're about to embark on another mind-expanding episode where we dive deep into the realms of psychedelics, sex, and the superconscious.
This is a transformational experience of healing, manifestation, increased clarity, flow, and alignment.
So join us on this sacred journey as we receive the codes of transformation from scientists and psychonauts, shamans, tantra masters, mystics, and more.
Together, we'll unravel the secrets of plant medicine, sex magic, and other tools to tap into higher states of consciousness.
So why are we here? To answer the call, to share our passions, and be advocates for alternative healing.
So get ready for a ride that transcends the ordinary and leads you to the extraordinary, because living a legendary life is not just a choice.
It's a sacred adventure.
Welcome, Tribe. Welcome back to Psychedelic Sex and the Superconscious. And today we have joining us Sonia Cotto, and she is a nurse anesthesiologist. And what's really interesting about Sonia, I'm so excited to have you here today, is that she really has found this way through her passion of mental health, of merging Eastern and Western medicine. And she now runs a ketamine clinic, but is doing it in a very unique way that's getting some amazing results. So, Sonia, I'm just really excited to dive into this with you today and to see what you're doing, how you're merging those two things together, the benefits people are seeing, why it's different than maybe some of the other like clinical places that people may go to get ketamine. And so, yeah, just curious, diving right into this conversation. First of all, welcome. And would love for you just to share a little bit of your background and story of how you got into all of this.
Yes, it's been a long time coming. I have always had a passion for mental health, but I did go through the nursing route and went into anesthesia and was doing anesthesia for a while. And in 2019, learned about ketamine's benefit for mental health. And I'd been giving it in large doses for anesthesia, but in very low doses without having the patient asleep and actually experiencing the ketamine without any of the other medications. It's so therapeutic and healing. And I just knew I had to, play a part, because it's so, I've grown up with it in my home, having the struggles with mental health and close family members, and just seeing the struggle of finding care. It was just trial of different medications, going higher, changing meds, in and out of hospitals. And it was very kind of frustrating and really hopeless for a lot of patients. And so we opened this clinic, not even knowing, me, Western medicine, really just, here's the infusion. And that's all you need. That's the answer for everything. And quickly learned that there's so much more to healing than just a simple ketamine infusion. Ketamine is definitely, I learned very quickly that it's a catalyst for healing, but there needs to be a lot of support. That is not the answer alone, and so we really started very quickly adding on other modalities, like automatically providing integration, prep sessions ahead of time, integration coaching pre and post infusions, providing integration coaching even at home and weekly in groups, and just adding those modalities has really, really made a big difference in our patients' outcomes.
Yeah, and I think this is an interesting conversation, because some people might not even realize like the history of ketamine. It actually was used for anesthesia, and I might be wrong. Maybe you could shed a little bit of light on this, but my understanding of it is like it was used a lot in like the World War I, World War II, when somebody would get hurt. It was just an easy way for them to have some kind of anesthesia so they didn't feel things. So it's a disassociative. And so this is actually what it was used for, is it's a tranquilizer to help people deal with pain. And then I think over the evolution of the past decade or two, what we've realized is that ketamine actually has other uses as well as a dissociative to help people with their mental health or healing process. So I think that's like an interesting point to bring up. I don't know if you have anything else to add about the history of how that all came to be. You might be a little more well versed than I am in that.
Yeah, it's funny. It's always, based off experience, different scientists, trying to, I think the first one was PCP, and we all know that is not a very good medication. It didn't do well for anesthesia, but yeah, it's been used since the Vietnam War. People think morphine, and that was used by medics, but it's actually ketamine since the Vietnam War has been like the buddy drug because it is
Oh.
so safe. It keeps your brain awake, it keeps your body awake. It just separates really the dissociative part separates the brain from the body at the limbic system of the brain. So you don't have the presence of this present moment. So patients not only like with morphine, yeah, you wouldn't feel pain, but you have the risk of bleeding out, low blood pressure, and stopping to breathe. Whereas with ketamine, you're breathing, it actually is really safe and it actually dilates the lungs and has really deep breaths and supports the blood pressure, heart rate, and everything. So it is a very, very safe medication. So it's been used, everyone calls it the horse tranquilizer, because it is commonly known for, in veterinarians, like putting lions when they need medical care or different, larger animals, because they usually call it a ketamine dart. So it's a lot safer that you can give them the medication from far away, right? But even in humans, we've just been using it forever. And I use it every day when I still do anesthesia. But doing it without the rest of the anesthesia, because normally anesthesia makes your brain go to sleep, so you don't have the actual experience of the infusion. But even just besides the infusion experience, you have so many of the chemical benefits, which is like my Western medicine, doing all the research, we always thought it was just one area of the brain, one receptor, but there's activity in all, so many receptors. Now that they're doing research, it's not just, NMDA, and I won't go like geeking out on the science part, but it's even on the pain, the opioid receptors, on different, the GABA receptors. There's so many, AMPA, and too many to name to
Yeah,
go
well,
deep
that's
into that.
interesting, and that's funny because I remembered it was a war, so even I'm learning more, like, the Vietnam War was the war that really started being used as that, but, yeah, and I think this is such an interesting conversation. There's so many directions I could go right now, but what's really
Right.
present, I'm sure we'll get to all of it, but what's really present on my mind is, number one, you said the safety component of it, so I think that that's
Mhm.
really important to bring out is that ketamine's actually
Yeah.
really safe and has been used for a long time. But what's your take on the evolution of this from being like this, being used for pain and, when somebody needs anesthesia to actually being used for a more broader spectrum of uses, like getting over mental health? What's the history behind that?
I think it happened with veterans that they were using it a lot, obviously in the military, and they would note, when certain veterans were having surgeries that their suicidal ideation or the depression was lessened. So it really, like ketamine clinics starting to come about, and actually all the way from 2000. And even off label in small clinics, I'm sure we're doing it a lot earlier than that. But really in 2000 was when some of the studies started coming out. The reason why a lot more studies haven't been is ketamine is generic. How can you monetize it? What company is going to spend the billions of dollars to do the research to show and prove it? Right. And that's where we have Spravato, because they were able to separate, like each chemical molecule has a left hand, right hand. So they were able to separate the left hand, right, and have a different modality and putting it into a nasal spray. And that's how they were able to market it and monetize it and be able to do the research that does show the benefits of it. And that's where kind of like where the evolution came with that. It's going to be very difficult because there are different and a lot of studies showing the benefits, but where's like the long-term studies, and that's where the government's looking for. And that's why it's always going to be considered off label. And that's why it's difficult for a lot of practitioners to say, oh, I would refer my patient for ketamine infusion therapy, but it's not FDA approved, right? But it's going to be very difficult for it to be FDA approved for mental health as that infusion.
Yeah, well, that's so fascinating to me, and I love that really this additional use for mental health became available because it was being used on veterans, which of course we know is a population of people that deals with a lot of mental health challenges just because of some of the things
Mhm.
that they've been through. And before we get into some of the ways that you use it and how you use it different, I just want to pick your brain a little bit more on the science behind ketamine because I'm curious to know how it works. Like my experience with ketamine, and I've shared this on a previous podcast, but actually my first experience with it was horrible because I had a different expectation. Kind of what the expectation was when I first experienced it was, hey, this is going to make you feel like you can talk more. It's going to put you more in your head, and you're going to have these extraordinary conversations. And then I was given the ketamine, and think I was put in what's called a K-hole, or a space where I couldn't move, where my body felt numb. Everything seemed slowed down, and there were people around me talking. And I think the dose affected them differently than it affected me. And I thought, this is, luckily I'd had experience with ayahuasca, like arrhythmia and some other things. So I knew if I just, surrendered and breathed, that eventually the experience would be over. But what was so incredible to me was because of the expectation, and the setting wasn't right. It was this horrible experience. And then I had another opportunity where somebody that was running a clinic said, come experience the clinic. And they also kind of brought in some of the Eastern medicine type of stuff. So I went in, it didn't feel like a hospital, it kind of felt more like a home. And they had, I had some prep calls, like, what are you wanting to get out of this session? And then I had some integration calls afterwards. And the extraordinary thing was the physical experience was the same. Like I was given a high dose of ketamine. I had this experience where I disassociated, where, like my body felt numb, but I had a blindfold and I had an intention, and I had the most remarkable, incredible, healing, expansive experience. And what struck me about this was, wow, how's this, first of all, how's this working in my brain? But second of all, really the importance of the set and setting. So first of all, I just want to talk about how ketamine works in the brain. And then I want to transition over to why sometimes we take it and experience isn't great, and what actually makes the experience of ketamine so that it's a healing experience. So it's experience that can actually be used for our benefit rather than just an experience where you feel totally numb in your body. So can you go into the science a little bit first, though?
Sure, sure. So traditionally, it is considered an NMDA receptor antagonist. So it blocks. NMDA receptors usually work with glutamate, which is the number one excitatory neurotransmitter in the brain and in the body. It stimulates activity and brain activity, communication in the brain, and among many others, but that's the main activity. When we block glutamate, the glutamate rises, but then there's other activities where then it is actually blocked at the limbic system. So the limbic system is where we actually get that dissociative effect because you are no longer in your body. So dosing is very, very patient specific. So while you may have received that first experience that was terrifying or horrible for you, but that dose maybe was the same as other people, but based on your body weight, based on your metabolism, the liver enzymes that break it through, it might have been a lower dose for you, and it almost kind of like a microdosing for the other people that they were still able to move. You were actually getting to the dose where you can't feel your body, which is great because when you need a surgical procedure and you're too sick or injured to receive normal anesthesia, that's a safe anesthetic because you would have been able to have a procedure, reset an injury or broken bone or suture and not feel it, right? And it would have been
Yeah, I
comfortable
couldn't
and
even
safe
feel
for
my
you. And
body.
that's
Like
where
3 hours later, I had to go to the bathroom, and someone had to like carry me to the bathroom. So I definitely
yeah.
was in that disassociative phase. But
Yeah. Yeah. I always joke with people. I'm like, okay, let's sort of learn to walk again, like in kindergarten as we go to the bathroom afterwards. And it's really just like you really connecting with your body again, like, okay, I'm moving, so we always, we always laugh about that, but it's, having that experience, you see how different it is because our goal for you, they always say, oh my God, I was in a K-hole. And a K-hole is only bad when you're in the wrong setting. And the wrong setting are so important because our goal for you is to go to that deep space, but you're not supposed to be in an environment with music and people talking. It's a very internal experience. Ketamine is, there are different, even if you get to like a psycholytic dose where your inhibitions and your walls are drawn down and you're having therapy, you're still kind of a little bit, somewhat out of body, but more of like out of ego. somewhat, where your wall is not up and you're not protecting and you're not controlling everything. You just kind of are able to release it, and that's where therapy sessions are so healing and therapeutic. As you go deeper, you really are getting out of the body. If your eyes are open, you're not seeing things that aren't there, and that's why eye shields are so important. Even one of my patients don't want it to wear the eye shields. I'm like, as long as you don't open your eyes, and I will sit in the room and make sure, because if they start to open their eyes, you're going to come out of the experience. It's really, I like to say that you're having an awake dream to your subconscious mind. And that's why you want your eyes closed, so that you can see what's there.
Mm.
Because everybody's good dreams are going to be different. No one ever has the same infusion experience. And even my infusions are different when I have them, depending on like different moments in my life or different things that I'm going through. The infusions are different, whether I've been eating healthy or not eating healthy, more weight or less weight, that all affects your metabolism, your nutrition leading up to it, and really also even your mindset, right? Going into it, when we have patients coming in like right out of work or just stressed with the transportation or family member, we don't start the infusion. We give them space in the room, which does not look like a hospital or out. So it's just very spa-like, or a living room, kind of like, with a recliner, low lighting, plants, and they listen to a meditation. And then when they're ready, then we'll start integrating, setting the intentions for the infusion. Because having that environment, but also the set and just being relaxed. Because otherwise, if you go into that infusion like all frazzled, that's literally how you're going to have your infusion, is a frazzled, chaotic infusion, because ketamine is a catalyst for what is already in your mind.
That's so beautifully said. And one of the reasons why I was so excited to interview you today is just based on our previous conversations and some of the success stories you've shared, which I'd love to hear some of those a little bit later in the podcast, is that you are doing things in a way that really helps people have success during their experience. And I think that, especially because ketamine is legal and there's a lot of different ways to do it, doesn't mean that every way is the same or every experience is going to be the same, because like you mentioned, so much of the experience depends on the set and setting. It depends on the preparation. It depends on what the person's experiencing. So I'd love for you to share what you're doing in your clinic, because I know there's people that fly in, even I think you said from different countries, to come to Florida
Mhm.
to have this experience in your specific clinic in this way because of the way that you do it. So love for you to share some of those things that have allowed your patients to have so much success with this, where they might have had a different experience in a different set or setting.
Mhm. Yeah, I think the main thing that sets my clinic apart, and then a few other ones that I found, is really the focus on not only preparation but the integration of it, and controlling the setting, and focusing on the after and the in between. A lot of clinics that I see, it's really just the infusion, and it could just be being naive, which is how I was in the very beginning, not being in that mental health space or not really understanding the medicine. Coming in with infusion, for the infusion, normal light, no head shields. Oh, you can watch TV or listen to the music that you want. And it's like, absolutely not. I mean, I used to let my patients listen to their own playlists until, I started hearing them, and you could see, like, in the middle of the infusion, I would come in because the patient's heart rate was like 120. And I'm like, okay, let's see, what was happening in there. And their music, it's like banging. I could hear it through their headphones, like rock hard music. And I went to their phone and I pressed next to the next song. And within 15 seconds, their heart rate went back down to 89.
Yeah. Well, I want to just pause
And
right here and say something about the music, because in that first experience I had, there was some music playing and I hated it. It was like being in this torture chamber, and the song itself is not that bad, but because of the experience, like with the music slowed down and things like that in my mind, it created, instead of this place of safety and beauty, it kind of created chaos. And then when I went and had another experience with a very customized playlist, that was meant for me. It was a completely different experience. So I just want to reiterate what you're saying, like that to
Oh,
me made a
so
huge
important.
difference. So yeah,
Mhm.
so what else? Keep going, because I think this is all.
Yeah, it's funny because my first ketamine infusion, I love classical music. So I'm like, oh, I'm going to listen to classical music. It must be beautiful. It was very traumatic for me. I had to like call out and be like, please help. I need to change the music. It was like so bad, but I love classical and I still love classical, but there's a time and a place for that.
Mhm.
And it was definitely not during a ketamine infusion therapy. And, so music's very important. Getting settled in, setting the intention, like you said, it's so important. Even though, your subconscious will take you wherever you're going to go during that, having that intention, even like a one word intention, like of your goal. I have patients that, as they set their intentions, they're like, well, my intention is to not be depressed. And we have to dig a little bit deeper because the world is energy and it doesn't know don't be. It only knows depressed. So we have to dig deeper. And it's like, well, if you weren't depressed, how would you feel? Right? What is the feeling that you want? We know what you don't want. That's why you're here. But what do you want to feel? And a lot of times they don't know. So it's a lot of coaching and guiding to like feel peace or safety or just feel content or joy, and just creating those words. And those are kind of like their affirmations that they can just repeat in their infusion, because going into your subconscious, you're going to see whatever it is that you see, but having that grounding for when, let's say you see something that's uncomfortable that you maybe weren't expecting to see, that your intention was clarity.
Mhm.
So, why am I seeing this? Because I want to find clarity on what's happening in my mind and clarity in my life or clarity in my goals or whatever it is. And it's presented to you, you know, and then guiding through that afterwards, whatever they see, it's then setting intentions for what they're going to do at home, journaling about it, depending on their infusion. Then I'll give them journaling assignments, and then my staff now, they know like pretty much different experiences. Then here's the, like, whatever their goals are, here's journaling prompts for these goals. There's journaling prompts for specific intentions and goals for why they're in their why they're here in our clinic, right? And just really working through that and focusing on that preparation, because then the work comes when they
Mhm.
go home,
Yeah,
you
and
know?
I love that you brought that up, and I'm a huge advocate for integration, because I think we can have these experiences and a couple things happen. First of all, it's different than anything we've ever experienced. So unless we actually take time to process, like, what did that mean for me? How is that showing up?
Mhm.
Why did that show up? And really taking the time to listen to that, it just turns into, wow, I had this extraordinary experience that didn't actually mean anything, other than it was a standalone extraordinary experience or bad experience or whatever that was, right? And then the other
Mhm.
thing too, I think, is the importance of implementation into life. And that's part of integration. Like, how is my life going to be different? If I'm going to take the time, if I'm going to do this, if I have an intention and I want a result, what am I actually going to do to create that result? And which doesn't happen in the space. It happens after the space. So I love just having that support. And I think that's the difference between, having a psychedelic experience or experience on ketamine, versus having a life-changing experience, having something that actually helps you transmute or change something in your life. So, yeah, I love that you do that. And what are some other unique things about your clinic? Like, how have you blended Western and Eastern medicine together in order to really support
Oh,
people?
yes. So not only have we added, I mean, obviously the integration and, the therapy and coaching along with it, but we still, going back to Western medicine is, you know, what is your nutrition? What are your nutrient levels? Because going into like functional medicine, really understanding the importance of how is your methylation process. If you're depressed and stressed, are you just living off of fast food? Are you even eating? Are you drinking enough water? And just basic stuff like being able to touch on those points with them regularly, because we see them minimum 6 times, usually about 8 to 10 times for the full process. And we try to prolong it. So each time it's like we're assessing all those avenues. And now I used to say, okay, go to your doctor, draw the blood work here, check these levels, because then you can supplement. Because if your vitamin D is low, how you can't make serotonin. You're going to have anxiety. You're going to have depression. You're going to have joint pain even. And people don't even realize that. So you're suffering from pain needlessly, thinking you have arthritis, and it's just low vitamin D, and so really looking not only just on the blood work of nutrition, supplementation, but also even hormone replacement now. So all of this stuff, and that's more like Western medicine, but being able to just do it one-stop shop, because none of my patients ever did get their blood work and show it to me. Very rare. So we actually started drawing the blood ourselves. We have accounts with like Quest and LabCorp and different labs that we can do, like micronutrient testing, gut testing. We have hormone testing, hormone replacement, because all of these play a role in their complete holistic health. I have patients where, they're going through therapy and it's very therapeutic for depression and anxiety, and they're still suffering through anxiety towards the end of their fifth or sixth infusion. It's not mental health related, it's biochemical.
Yeah, that's a really interesting point, because so often I think when people are turning to things like psychedelics or like ketamine, they're just looking for an answer outside of themselves, but it doesn't fix if you don't have the proper nutrition, if your hormones aren't in balance. Like it can be like a Band-Aid, right? And then you just are taking off it's like an
Yeah.
open wound that you're just trying to put a Band-Aid over. So I love that. I love that you take that approach. I also want to hear some success stories from people in your clinic, because how many patients have you seen now? Do you have a number for how long have you been open?
Oh, I should. Well, so we've been open since 2020. We opened in March of 2020. So we quickly closed. Like we were like, yay, we're open, and we're not. And so we actually officially opened in May of 2020. So we started off, doing like maybe 20, 30 infusions a month, to then now we have a few, 100. So we probably treated maybe a couple thousand patients, if I had to just say it off the top of my head, with ketamine infusion therapy. And it's seeing the transformation. I mean, we go from treating patients like postpartum depression. One of our first patients, he was a veteran that he couldn't even get out of bed. He only got out of bed in desperation to finally come to us. Because it was hopeless. He couldn't get out of bed to raise his kids. And I remember seeing him on the first infusion. I actually even had to get cardiac clearance because his resting heart rate was like 120. That's how severely panicked, and it just all the time anxiety related. And when he came in that third infusion, just to be able to, he had taken his kids to the park. He all of a sudden had a glow in his eyes, a sparkle, like he had his life back again. And he, his wife was just, I have a husband again. I have, the kids have a father, and just seeing that activity and just seeing that transformation. I've treated teenagers. I have one that stands out in my mind that, a lot, sadly, being sexually assaulted or, brutally attacked, a few of them. And even when going back into their infusion experience, they've actually observed that traumatic experience. But I remember her describing that she saw it, but it wasn't her, even though it was. And it was more of like, this was an event, and she wasn't traumatized by it anymore. And I'm crying, as she's telling me the story, because she was surrounded by her family, just as an observer. Because when you experience certain things with ketamine, it's almost like you're watching it. You are, in self. And when you're stuck, I describe it like you're in a jar, right? There's everybody that's giving you feedback, therapists, family members. They're trying to tell you, this is not what you should be seeing, but it's hard because you're in the jar. You can't see it, and then you get into this awareness, or I call super conscious, where you are now outside the jar and you are the observer, and then you get to be really aware. And when I have clients, I even had a medical student that was very Eastern medicine, very spiritual, went into surgery and completely was lost and severely depressed because they were miserable in that Western medicine role and just stressed out in medicine and surgery and all this. And in her infusion, she was up floating above the ocean as the medical West self. And here comes her other self, the Eastern medicine. And they actually communicated. I don't even remember the conversations that they had in that experience, that then they hugged and they merged as water.
Wow.
And it was just so therapeutic for her. Like, it was just very healing. And she realized that she could be both, because she was just kind of torn. She had to give one up or the other, and she was almost going to quit
Wow.
school.
Well, yeah, and that's
So,
amazing. I know in hypnotherapy and NLP, one of the things that is taught is, how do you step outside of the situation and view it from this like kind of objective perspective, and then you can start healing. But it sounds like ketamine just does that for people. It allows them to be outside of the experience
mhm.
because it's a dissociative. So maybe they can see things, experiencing things from a different perspective. So and obviously, like what I'm
Yeah.
hearing from you is ketamine therapy is great for, somebody with PTSD, somebody who's had a traumatic experience that's impacting their life, for people that struggle with anxiety. A really great way to kind of take themselves out of, how I like to think about it is it being in the middle of the anxiousness. So I was diagnosed with OCD and anxiety disorders as a teenager, and I know for me, sometimes I felt like I would get so into it that I'd be so in the experience and I can never get out of it, no matter how hard I tried. So I'm seeing that ketamine's great for that. And you did tap into something too. You mentioned the super conscious. I would love to hear from you too, if you could expand on how you feel like ketamine can also be used for expansion, because we know it's great for healing. And once we've done the healing, there's always more healing to do. But once we've kind of gotten past the trauma of the healing, once we're outside of that bubble of anxiety or a trauma, then how can ketamine be used, or how have you seen ketamine be used to expand consciousness, or even to access what we call the super conscious? And maybe you could give your take on the super conscious as well.
Oh, yes. Yes. I'm definitely still new to all of the consciousnesses of self, but definitely with ketamine, because I can describe ketamine, and as the doses go, and I'm sure you knew, like, when you had the mildly high dose and then you had the higher dose and the infusion, but your ego is very intact right now as we're communicating. Our ego, what I say, how I feel about what I'm saying, is completely intact and controlling everything. And as you go with ketamine, as you go deeper and deeper, I always say the second infusion is probably like the most difficult for patients, because their ego is about to be released. Like, the ego is going to be gone and they're fighting for control. So most of the time, most patients, that's if they're A-type personality, super controlling, the second infusion is going to be most difficult. Where to the point where they will describe, I feel like I didn't have any medicine. And the whole time they were like fighting it. I'd have to sit with them. And I'm like, just release, just succumb and surrender to the experience. And they just can't, because their ego is about to be gone. And then the third infusion, as they go deeper, they're really able to just connect with self. And that's also important, because you have, our consciousness, and then we have our subconscious. And our subconscious is where ketamine has that role, and where you can work and discover all the negative self stories that you've created based on events in the past. That's where you can connect with the subconscious and really see events for what they were, without your ego saying, here, see, that's why you were stupid, and see, that's why you're not good enough, and this is why you'll never find love, and you'll always be broke, and blah, 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 blah. And the stories go
Yeah.
on and on. You becoming aware of that is
Yeah,
so
I
powerful.
think you're right. Like, a lot of it's just the story that we've created around something. Like, the experience is gone, but the story we have is still there. And Joe Dispenza talks a lot about this, but we're operating in our present from these stories we have about our past experiences, rather than just being in the present moment now, which is where we're safe and we're okay and everything. But because of these past experiences, we feel that. And that's interesting that you say that about the ego. I had that interesting experience when I went to the ketamine clinic. It was my second time experiencing ketamine. And it was interesting for me because I went in with the intention more on the expansion field of like, oh, I want to know, like, are there any secrets out there, like secrets of the universe, secrets inside of me, like what knowledge do I have untapped? And going into the experience, I was actually with Gerald. So we were lying side by side, as a dissociative. So it's not like we could really feel each other or anything, but we wanted to have this experience in the same room and be together. And as I went in, I remember closing my eyes and just feeling myself surrender into that space. And the whole time I heard, I love Gerald. Like I went to like innermost parts of my soul is like, I love Gerald. And I went to the outermost parts of the universe. It's like, I love Gerald. And I remember at this one point as I was kind of coming out of it of being like, wait, does this mean I'm codependent? Like asking this question, like, is this okay that I'm having this experience? And the answer I got was like, this love that you have with him, this is pure love. And it's an expression of that. And you are love in being, and in being you are love. And that was like the message that I got out of this was just in my beingness, in the state of being and feeling and having this relationship, that this was me shining my light, that this was the big secret that I was looking for. It was just love, and being in that love just has this ripple effect. So, and I don't think I would have come to that conclusion had I had ego. And it's interesting because my ego shows up in a little bit of a different way, which is the people pleasing. And what I didn't realize was how much of what I was saying or doing, or how much of my experience was filtered through. I'm also I'm very empathic. So a lot of what my experience is it was filtering through how I thought other people would perceive me, or how I thought, what I was saying, like I would say things that I thought they would want to hear, rather than the things that were coming from my internal truth. And when I was able to have that experience where my ego was taken out of it, I was able to see something that was very profound and powerful for me, from a different perspective and lens, without story and without ego. And even at the end, when I asked about the codependent, what I realized was, oh, this is just a story that I've created based on conversations I've had with people, or things that I've read, or other experiences that I've heard. So I really love that you mentioned that. And I think that's really powerful. And I just really want to honor and love the work that you're doing. And just curious, so for people that are, listening in on this conversation today, that are joining us from the tribe, that are thinking about, should I experience ketamine? How do I experience ketamine? Like, what would be the process for them if they wanted to come to your clinic, if they wanted to experience it in this more holistic way? And one other thing I want to bring up too, because I think this is really powerful, is that you mentioned that you do series of sessions with people. And I think that that's really something that I want to emphasize too, is that this isn't just like a one and done thing. If you can go through a series, if you can do a series that kind of build upon each other and have support, it can actually be really beneficial. So, yeah. So what's the process for somebody that's wanting to experience this?
Yeah. So, yeah, I definitely wanted to touch on that because, there's a lot of retreat spaces, and I've done retreats for veterans, which is also very therapeutic. When you do like a psychedelic plant medicine, it's like, oh, well, I only need one time, but it's anywhere from an 8 to 12-hour experience plus integration and all that. With the ketamine infusion therapy, an office visit is 2 hours. The infusion's like 45 minutes. And you were building up to the dosing that is your ideal dose. So it's not like you're going to go into, okay, you're going to get this specific dose and you're going to get it the first time around. No, you're going to slowly, I like to say, like peel the onion as we get into your subconscious. But you're still going to get the same chemical benefits. The first infusion's low dose, where we start at 0.6 milligrams per kilogram. It's always by body weight. And it's just that experience to see how do you not only metabolize the medications for a nice little introduction. Most of the time it's very meditative, maybe some colors. A lot of time it's just floating in space or nothingness. and just being in there in that calm meditative space. And then we go and we start the integration coaching at home. Then you start having deeper infusion. And mind you, I have patients that first infusion is their ideal dose, and then we have to go down. That's a low dose. So it's always safe for most patients to start at, but I have 4 people I know those same 4 people that they.
Yeah, I think maybe I'd be one of those people, because I think mine was 0.6 and it definitely sent me to like a different dimension. So
Right. Exactly. And we don't necessarily want that for your first time, because you do want to always be able to make sense of it. And you have medicine experience, so it wasn't as terrifying for you.
Well, the
I wouldn't say
first time it
terrifying or
was, when I
intense,
didn't
but
know what
it's,
to expect, and I was
well,
like, I
yeah.
don't like this, but yeah.
Yeah. That was a scary. I was scared for you just telling me that story. But just building on that dosing and slowly going deeper and then deeper, and really just getting to the core, where ego's completely gone. It's funny when you were telling the story about, I love Gerald. And then coming back, it's almost like there comes the ego saying, well, no, you can't love him that much, because that's dependency, right? That's that story coming in, and that's the ego empowering. So I'm glad that you had that experience outside of the ego to really know that was like the super conscious, the conscious, every experience in every realm that is just pure love. And it was just ego just pouncing back in to say, no, that's a little too much love, And so really being able to sit with the patient and support them throughout. So we start off with a minimum of 6 infusions, and we actually prolong it to 4 weeks. You can do it in 2 weeks, but that's like 3 infusions, boom, 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 each week. And how do you have time to process? Like, we create assignments like, okay, you need to journal about this. You need to create joy or happy lists of things that you enjoy doing that you can't or haven't been able to do because of your depression or your pain or your anxiety. We assess what their sleep is like, how to coach them on getting better sleep, how to detox, because we are so toxic. We are exposed to so many toxins. Sometimes it's as simple as, is your Wi-Fi router in your bedroom, right? How many times are you actually putting your feet in the ground? So having the multiple visits allows them to integrate it and really assess how they're behaving at home, and that's where you then get the real long standing change, as opposed to boom, 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 3 infusions a week and be gone, and depending on the diagnosis, they may even need more. So we kind of assess it as
well, you're
as
definitely
we go.
inspiring me to to have a different experience and to dive a little bit deeper into this in a more meaningful way. And just even like the results that you've described are so powerful. So, and I really want to say to everybody listening on here again, how we use these medicines and how ketamine is used, the setting, the intention, even doing it multiple times, like you said, this is where we really reach a different state of consciousness. This is where we really get to see a difference made in our life. And if you don't just want to be stuck in that, healing loop or healing cycle, which I think some people get addicted to, they have an experience, they feel good, they go back,
What's
to
a habit?
their old habits, and then they're like, oh man, now I want to have another experience. But there's no real growth in that. It's just a one-time experience. And in some ways, it's almost even more painful, because you're moving from that state of like unconscious incompetence to conscious incompetence. Like, now that there's something better that you could be doing. Now there's a different way, but you aren't doing it. So the support is so profound.
Yeah, because once they get to that point, you have to still continue to support them, because how are they? Because now that you're aware, I had one patient that he subconsciously always says, life sucks, because his mother said it. And it's just his broken record. And when he realized it during an infusion, he just, every time he caught himself, he said, life is perfect. Life is perfect. And that was
Well,
transformational.
again, thank you so much for the work that you're doing. We'll put a link to the clinic in the show notes. But if there's anybody that's listening right now that's curious, that wants to experience this, like what would be your message for them, and what would be your invitation?
Well, First of all, it is very brave and powerful to be able to take control of your mental health. To be able to call and reach out for help is so powerful. And being able to use this powerful medicine in such a safe way, there's no need to fear it, because imagine like me doing anesthesia, I give such high doses. And in this infusion, it's very low dosing. So it's very, very safe, very therapeutic. And, just reach out, ask questions. There's so many different modalities. And even if you can't make it to South Florida, when you look for different clinics, ask, do they provide integration coaching? What does their room look like? Do they provide eye shields, or can you have your own eye shields or playlists? Our playlists are public on YouTube at Ketamine Clinic South Florida. So always use our playlists if they don't provide it for you. Playlist 1 through 7 are, program for infusion 1, 2, 3, 4, and so forth. So very healing.
Yeah.
And,
Say that
yeah,
one
great
more
to
time
use.
again. Where can people access the playlist?
Oh, on YouTube, we have a channel called
Okay.
Ketamine Clinic South Florida. And it's just those, and they can use that. And that's our website too,
Awesome. Well, thank you so
ketamine-southflorida.com.
much again for taking the time, for educating us, and really for the work that you're doing. I know this is something that is really a passion project for you, and coming from your desire to really help people. So I appreciate you so much. And Tribe, thank you so much for joining us for this conversation. Hopefully you feel inspired and more educated, and we'll see you next time.
Thank you so much for having me.
Thank you, legendary explorers, for joining us on this cosmic journey today.
Your curiosity fuels our exploration of psychedelics, sex, and the superconscious.
If you're hungry for more, dive into our website and connect with us on social media. All the links are in the show notes.
And stay tuned for our next mind-expanding episode. We can't wait to talk to you again in our next adventure.
Until then, remember, this is your life. So,
make it legendary.